Hello, welcome to another episode of the Project Purple podcast. I'm Dino Verli, founder and CEO of Project Purple. We've got an exciting interview coming up with a very special guest after a few quick updates. Since 2010, we've contributed over $3 million in counting to pancreatic cancer research efforts. We've also allocated over $1 million worth of aid to more than 1,500 patients and families through our patient aid programs. Your monthly or one-time gift can improve patients' lives through research and assistance programs. You can donate now at projectpurple.org. Pancreatic cancer does not rest, and neither will we. Your support is truly appreciated. If you're looking to get involved in one of our events, whether that means joining a run team, participating in a virtual run walk, group fitness, golf, or anything else you can think of, visit projectpurple.org/events to learn more. Without further ado, let's meet our special guest coming to us all the way. I say all the way a lot, but yeah, it's kind of far from us here in sunny, warm Connecticut, sunny, humid Connecticut, but also coming from a very sunny part of the country, from El Paso, Texas, Carlos Charlie Morales. Welcome to the Project Purple podcast.
I'm glad to be here with you this morning.
And so I'm excited every time we bring on survivors. We call them our superhumans. I know we had to kind of move our schedule around and get you back on the calendar, which is awesome because anytime we ever get cancellations, I get kind of nervous. I know, with this journey, I know it's not easy, but it's always great to get people back on so they can share kind of their journey. And I know we're playing a little bit of catch up here. You've been in El Paso, you've been in the trucking industry for a long, long time. Excited to hear your story. I know we traded some emails back and forth, so I got a little bit of flavor. But as I said before we hit record, really on the podcast, when we hit record is really the first opportunity for me to kind of hear the story firsthand and be able to share that to our audience. So with that, Charlie, I'm going to hand this all over to you to share that journey. And as I said before we hit record, the microphone is yours, and I'm going to be taking some notes and then listening to where you take us.
All right, sounds great. I do like to talk. Well, I'm kind of a neophyte to this journey because I got diagnosed in January of this year, and the journey to the diagnosis was an adventure. I started getting sick last September. When I started this adventure, I weighed in at about 327 pounds. Pretty hefty guy. For a guy who's only 5'6", that's very hefty, unhealthy. But that all started with stomach aches and pains in September of last year, and then a diagnosis at the ER of pancreatitis, and lipase numbers were. Lipase is the enzyme that the pancreas manufactures in order to help you break down foods. Anyway, my lipase numbers were elevated from 60 to 340 to 49, which is not a big elevation because the spectrum is from 60 to 8,000. So anyway, they diagnosed me and then sent me home with nothing. They didn't tell me do this, do that, see this guy, see that guy, other than to try to get into a GI. Well, at that point, I tried to get into a GI, and I had an appointment for May of this year. Was my first appointment with a GI. That's how long it was going to take to get in. So at that time, I couldn't eat anything. Everything I ate caused extraordinary pain. Even drinking a sip of water, just didn't put me into convulsions, but pretty close to it. I mean, the pain was just horrendous. And so I started losing weight pretty quick. And a month later, I was back in the ER, same issues, same problems, same diagnosis, but this time the lipase numbers were up near 1,000. Still not a big deal, but still high enough for them to use that for the diagnostics. And again, they didn't do much. They didn't do anything. I had a CT scan both times I went to the ER, and then I ended up in the ER for a third time, another CT scan. This time, I had gotten a hold of a GI, and they're based out of the Texas Tech physicians clinic here in El Paso. And somebody that worked in the office got a hold of my record somehow and was looking at the CTs, and they said that, you know what, you need to get in to see the doc right away. Your issues are more complicated than the ER docs seem to think. So he pulled some strings and got me in to see the GI within a week. It was miraculous. So I get in to see the GI in early November, and based on the records, everything that's come from the ER, 3 CTs, which show nothing at this point, no mass, no anything. They decided that they were going to change my meds. They said, well, you're taking a couple of meds that interact and could cause pancreatitis, so let's stop this. And keep in mind that by this point in November, I've lost about 80 pounds from September through November. And
Charlie, so when you say losing the weight, so I just want to bring this up for the audience, for those watching and listening. So were you not eating, or were you just eating and just wasn't, like, weight was just coming off?
No, I wasn't eating. I called it the famine diet because I was literally starving to death. I couldn't eat. Anything I ingested, I tried to take orally. It wouldn't come back up, but it caused so much pain going down that I just stopped eating.
Yeah, so your appetite just was none.
Yeah, my appetite was nil. I would assume I was depressed to a certain degree, but they changed my meds, told me to come back in a month. Nothing had changed. It was the same problem. Another 30 pounds down in a month. I mean, I was losing a pound a day. It was crazy. And they sent me to do an MRI. Mm-hmm. And it was going to take the local hospital that they work with, UMC, it was going to take them 2 months to get me into an MRI. So I did it out of pocket. I said, screw it, I got to do this. So now I've got 3 CTs and an MRI and nothing. No results. They don't see anything yet. In early January, I got so sick. I was still trying to eat, but at this point, I got so sick that nothing would stay down. Everything would come back up. So I go back to the ER. This time they take it seriously. Okay, something else is going on here. So now back in the ER, and they finally do the first endoscopy. For me, the endoscopy is something they should have done in the first visit to the ER. They should have admitted me to the hospital. To me, it should be a protocol. But, these are things that I've learned. This is just things that I'm picking up as I go. But at that moment, I didn't know endoscopy from shimposcopy. It was like I knew what it was, but I'd never had one before. Yeah. At any rate, they did an endoscopy, and right away they found the mass in my pancreas. So that was on January 18th. Then they scheduled me for a the ultrasound. Yeah. The endoscopic ultrasound.
Yep. Yep.
Yeah, and that's when they were able to actually do the biopsy.
Yeah.
One of the problems I have is that the mass has grown into my duodenum.
Yeah.
Okay, which is the connection from your stomach to your large intestine. Yeah. So what that told me at that point was that none of the food that I had consumed or forced myself to consume had gone anywhere farther than my stomach. Basically, the food was just rotting away inside there. As gross as that sounds, it's the facts. So they ended up having to do jejunesectomy, which is similar to what they do for people who are having bypass surgery for being overweight, for obesity. But what it did was it saved me from having to have what's called a J tube, which is a feeding tube. Yeah. There's one doctor, Dr. K, here in El Paso that could do the surgery, who was attached to the Texas A&M. I was kind of locked into Texas A&M and UMC. I couldn't just stray and go anywhere I wanted to. I don't have insurance, no insurance at all. So, and they got programs. So this doc was leaving Texas Tech within the week. So he postponed 6 other surgeries in order to do my jejunesectomy, which has given me a quality of life that I didn't expect to have. Within a couple of weeks, it made it possible for me to eat food again and digest food semi-normally. I still have issues with appetite, still losing weight, but a lot of that just has to do with the cancer itself. Pancreatic cancer is very aggressive. So at this point, they set me up for my initial chemo. And it's the standard 5-FU chemo that everybody does. Yeah, and so they got me in for my first chemo. And right after I did my first chemo, I became jaundiced. And so what we didn't know at the time was that the mass was putting weight on the common bile duct. So basically occluding it. Mm-hmm. So none of the bile was passing into my large intestine. So it was just poisoning my body. So my bilirubin numbers were skyrocketing. So I had to wait. I was a week out from my next chemo, because you do chemo for 3 days and then you wait 12 days and then you do another chemo session. And that's the way the 5-FU chemo works. So at this point, it's like, okay, I'm jaundiced. My eyeballs are yellow. What do we do here? So I happened to have an appointment with my GI that Friday, and he saw how jaundiced I was, so he wanted to admit me to the hospital right away. This was the 9th of February. I told him, dude, I'll be damned if I'm going to miss the Super Bowl, or if I'm going to watch the Super Bowl from a damn hospital room, because I knew on the weekend they weren't going to do any kind of procedures on me. Yeah. So I was going to have to sit there for 2 days to wait. So I said, no, I'll check back in 6 o'clock in the morning, Monday morning. So I did. My team didn't win the Super Bowl anyway. So anyway, so we were there early Monday, and then you go to the ER because you have to be admitted. That's the way the system works. And because you have to go to a what's called interventional radiology. They're the ones that deal with this type of issue. Yeah. They're the ones that put in the port caths, which I already had a port cath installed for the chemo and stuff. So on Tuesday, they finally got around to me, told me that they were going to have to install what's called the biliary drain. Yeah. So for people who don't know what that is, basically they cut a hole into your side in between your ribs, put a tube, a hard plastic tube, kind of with a needle guide on it, inside you, which goes right into the common bile duct. And then what that does is it allows the bile to drain out of your liver and into a bag that's strapped to your leg, kind of like a Foley cath. Mm-hmm. And so that was going to be that became my new normal. So the biliary drain was very, very painful. But it wasn't as bad as sitting in the hospital with a nasal tube. Oh my God, I hated that NG tube. It was like, you're familiar with it. It goes through your nostril, through the back of your throat. So you're scratching your throat. You're choking on it constantly. And even though it was there only for like 4 days, it was horrendous. So now I got the biliary tube, a new thing to deal with. So I'm dealing with it. At least I'm starting to get my appetite back, which is good. And, so now we need to bring the biliary numbers down, the bilirubin number down, so that I can go back into chemo. Yeah. So I missed, it took 4 weeks, and I was able to go back into chemo. And then, well, no, that's not true. That's not true. That's not what happened. I was going to do my second chemo session, but before that, I had to go to the PRC, my primary. My primary was not available, and there was another primary who was backing her up, and he had a student. So the student wanted to check. So since this was post-surgical procedure, because the IR is a surgical procedure they do to you while you're awake. Mm-hmm. It's not something that, that you don't go under a general anesthetic. It's local. And anyway, so he pulled off the dressing. These tubes have to have this special fixation device. It's called Stay Fix, and that holds it to your body so the tube doesn't move, so you don't get infected. Well, when he pulled the dressing, he pulled the Stay Fix. He pulled out the tube. Oh. So, this was a Friday. So I go back to the hospital on Monday. Well, by now I've got an abscess. So now I've got a huge infection. So now I got to deal with the infection and broad spectrum antibiotics. So that's 4 weeks. That took 4 weeks out of my schedule. So by this point, I've only had my first chemo session. So the biliary tube is something I've been dealing with in a negative way since it's been installed. I've been having to go back and forth to the ER every couple of weeks to have this thing replaced because it keeps migrating. It'll do it on its own. If you cough, it could kick out. They try to hold it in place with sutures and different things, but it's not a very sustainable system. It's just one of the things you got to deal with.
Have they ever talked about stenting the?
Yeah, but the problem is that because you can't get a scope through the duodenum, there's no way. The surgery would be so invasive, it's almost akin to a Whipple, where they literally have to cut you open. It would just be probably cause more damage than good by trying to put in a stent. So they're saying if we can get some shrinkage, if we can shrink the tumor,
correct,
then we can probably stent you, and which would be way better for me than the biliary drain.
I got a question for you, and I don't know if you've asked this. I mean, I know my journey and what I know, and not to but I guess hear you talk, like you do this this procedure to undo the blockage in the duodenum, right? So that you can eat versus having like a feeding tube, right?
Well, actually, no. They couldn't remove the blockage because the surgeons won't operate on a pancreatic mass.
Okay.
It's the last thing they'll do is operate on it.
But what did they do though? The procedure that they got.
The procedure I had was
K
on my jejunum. Okay, so that's a jejunum. That's a tube that's on the front of the stomach, and they attached that to my intestine in order for the food to go straight into it.
Correct. So was that part of the complication why they won't go in and put the stent?
As far as I know, the jejunum has nothing to do with jejunoscopy. Has nothing to do with why the stent is not an option. My GI just keeps telling me, and I'm going to be seeing him again Friday. Yeah. Just keeps telling me that it's not in the cards. It's just that this biliary drain is going to be my new norm in perpetuity. Because, oncology docs will tell you when you have pancreatic cancer, it's not truly staged at this point.
Yeah.
They're calling it a stage 3, but I haven't seen any numbers that say specifically why it's a stage 3. But it was like 2.4 centimeters by 2.8 centimeters when they first diagnosed it.
Yeah.
So since then, and five chemo sessions so far, it hasn't changed, which is probably the best thing you can hear this far into, because it's been 5 chemos, but this is ongoing since January. So it's been 6 months. 6 months, I should have had 12 chemo sessions, but I've only had 5. And
I'm just curious because I know, I'm not a doctor, but, from what what we see, usually there's that stent that's put in if there's that biliary blockage, right? And, people have the tubes put in, as you articulated, there's a lot of complications with that, right? There's a lot of challenges to that. The flip side to it too, stenting though, I know I've known people that have gotten stents and then have to get them redone like every month, right?
Right.
And I think the other piece to this is, and you're kind of alluding to it as well, like every time you do one of these procedures, there's risk, right? Like you mentioned, like that first time, like
Correct.
There's that abscess, that infection, like any procedure. I know we're talking about pancreatic cancer here, but anything you do, right? Like if you go and get your wisdom teeth removed, like there's risk, right? Because there's a suture and there's a medical procedure, even, like preventative stuff like CTs and MRIs, like there's a risk, right? Like it's very small and we're very good at doing those types of diagnostics. But as you get into the complexity of this disease, the risk goes up, clearly with some of these procedures. So it becomes maybe a risk reward from the diagnostic standpoint and from the doctor standpoint. But I just want to, I wanted to bring that up. And I know we've talked about stents previously in the podcast with other patients, and, there's complications. And a lot of times, I've heard clinicians say, like, once you stent, then, there's a high number. I don't have the exact percentage, but, you're going to have another stent eventually put in there. So, not to say that, one is better than the other. Again, I'm not a physician or clinician, but we have talked about that previous on this. So you get through these chemo sessions with a lot of these, I guess we would say, challenges. So where you are today is you're still going through active treatment.
I'm holding off on treatment again because of another infection.
Oh.
So about 7 weeks ago, I was in the ER for the biliary drain. I was having issues with my bladder. So they decided to drain my bladder because I wasn't in a lot of pain, but it was discomfort. And so it was secondary to the biliary drain issue. So they put in a Foley cath and started draining my bladder. Well, in 45 minutes, they took 3 liters of urine out of my bladder, which is ridiculous because your bladder is designed to hold like 500 mLs, half a liter. So 3 liters scared me. So I had to suffer the degradation of a Foley cath for a whole week. I hated that almost as bad as the NG tube. Got in to see the urologist. Luckily, I got in quick. And they just told me, well, your prostate is enlarged, so it's causing a blockage. So they removed the Foley cath and allowed me to self-catheterize. Intermittent catheterization is what they call it. A lot of guys wouldn't want to do this to themselves, but hey, I'm an adventurer, so I'll get in there, poke it, prod it, make it work. Oh yeah, I know. Yeah, you're squeezing your legs right now, thinking about it. Yeah, I can understand. Yeah, it's not as bad as it sounds. It's not great. It's not a party, but it's better than a Foley catheter. If you've never had a Foley catheter, you don't know what I'm talking about.
Yeah.
You've been there?
Unfortunately, yeah. I had a procedure and I had to have one put in, and it was yeah. And I know, and for those watching or listening that have gone down that road, it is not something that I don't think anyone, anyone
you had a procedure on your prostate? You had a procedure on your prostate?
I had on my lower back, and I.
Oh, okay.
Yeah.
Because of the surgical procedure, they had to keep you catheterized for a while.
Correct. And
I understand.
Yeah. And so they had to remove, because I had a nerve block on my spine, basically. They put a block in to do this procedure. I had a cyst at the tail of my tailbone that was removed. So it numbed everything out, but they had to remove everything, and they couldn't remove it, then they had to do it themselves. So, all right, if I couldn't do it, they had to do it. Let's just leave it at that. So,
I mean, it's a self-catheterization is very different than a Foley cath. I mean, a Foley cath, they stick it in you, they blow up a balloon, and it hurts. You can't sit down, you can't get comfortable.
Yeah.
Self-catheterization lasts for however long it takes you to empty out your bladder. Sometimes it could take up to 3 minutes. Most of the time, it's 1.5 minutes, 2 minutes, and then you're done. Pull it out, throw it in the trash, forget about it. The problem, though, is that, the problem that came from this, so about 6 years ago, when my PSA numbers were first high, and they were checking out my prostate way back then, and they were setting me up for a biopsy. They did an ultrasound and they did all that. Well, they told me that I had a 13 or 14 millimeter stone in my left kidney. So for those of you who don't know, that's almost 2 inches long. That's a big ass stone. Well, they said nothing you can do about it. It has to be removed surgically. You can't pass it. So one day, if you have this horrendous pain in your left kidney, get yourself to the ER, and you probably have an infection. Well, the day came and went, but I never had any horrendous pain in my left kidney. I had a little bit of pain in my left kidney. With everything else that was going on, didn't think twice about it. I ended up back in the ER again. Why? Because my biliary drain had migrated out. So I was back there so I could go to IR. Well, the CT scan showed that the migration. They took me in and did the biliary, replaced the biliary drain again, and then sent me back to the ER room. And then another doc comes in, FN, not an FNP, but an NP, a nurse practitioner, says, "You have to have emergency surgery." I said, "What? What the hell? Something happened with the Foley?" I said, No. This has nothing to do with your Foley. This has to do with your infected kidney stone." And I said, "You mean the big giant kidney stone?" He says, "Yeah, the big giant kidney stone. So you have to go in and they're going to place a stent in you to divert all the stuff from your ureter down into your bladder so it doesn't go through your urethra in order to stave off sepsis." I'm like, holy crap, it just keeps on coming. Just a good time is just keep on rolling through. So they did the procedure, which I didn't. Of course, it was a local anesthetic, so I didn't feel or notice anything with that. It was done quickly, 15, 20 minutes. And then they started the broad spectrum antibiotics, IV antibiotics. And they did, I am diagnosed as septic. And so there was enough poison got into my blood that it poisoned my blood slightly. So I had to do, they put in a midline, which is a PICC line, which goes, in this case, in my arm, was put in here, and it goes straight to my heart so that I could do IV antibiotics at home. What could be simpler, right? Well, of course, the PICC line had to leak medicine, had to leak, you have to flush it out with saline solution. So, it's just like, come on, man, give me a break. We figured out a way with the home visiting nurse to be able to get at least 95% of the antibiotic into my body by stretching my skin and manipulating my arms in weird ways where my right arm would be locked into a certain position for 30 to 45 minutes while we got this stuff in there. That was very uncomfortable and painful, to say the least. But hey, again, my new norm. My new norm has been pain since last September, different kinds. It's just, I'm learning new parts of my body that can cause me pain that I never, ever thought I'd have to worry about. I'm 63 years old. Last thing I thought I would be dealing with ever was pancreatic cancer. I lost my dad at 51 to colon cancer. So I've been tested, colonoscopies and stuff. I kept abreast of it since my 40s, and everything always came back negative. So this was a shot out of nowhere, unexpected.
Charlie, I have a question. I want to jump in here because you bring up a very important point here. You said colon cancer with your dad. He passed away at 51. In this journey here with these guys in El Paso, has anyone done genetic testing on you? Okay.
Yeah, so I tested positive 53% for the gene that causes pancreatitis and breast cancer.
Like BRCA? Was it BRCA or?
Yeah, BRCA.
So you are BRCA positive.
Yeah, they said 53%, whatever that means.
Okay.
So I'm not eligible for any immunotype treatments. What do they call them?
There's clinical trial. I mean, there's a lot of clinical trials, but immunotherapy is like one.
Immunotherapy.
Yeah, I mean, immunotherapy as a whole, though, as in pancreatic cancer, really hasn't. We haven't seen the successes that we've seen in other diseases or other cancers. Knowing, and we can talk further offline, like the BRCA positive, knowing that there is a treatment protocol that could potentially make a big difference, and we'll talk more offline about that. But I think that's something that's the physicians there in El Paso, knowing that you have that genetic piece to that is critical, because that's one place where we've seen this space kind of go, in a positive direction with these genetics and understanding, and almost the term has been used a lot, about like personalized medicine, because everyone is different in terms that your gene makeup is different than mine and everyone else. And the other piece to this, and I know you have a extended family, and we'll probably talk about that here in a bit. kids, right? Like your genes are passed on to your kids. Now,
They've all been tested.
yeah, just because you have BRCA doesn't mean that your kids, it's a 50-50 shot, right? Because
Right.
it's genes from the parents, both parents, mom and dad. So, that's something though that I know we've talked extensively here on the podcast about genetics. So I just wanted to bring that up because that often does come up into a conversation when we talk about these journeys. I want to make I want to ask you a question. I know you gave me some background. You've been with your wife a very long time, 47 years. You guys
Yeah.
experienced, your first child. You said, I know in the notes you sent me was born premature and passed away 4 days after birth. Apologize for
Right.
that. You raised
Thank you.
three wonderful, supportive kids post. And where I'm going with this is sometimes you kind of see as the host, I see kind of like an arc, I guess I would say. I've used that term, but people experience things early in life, like a child loss, right? Which is traumatic, right? And you go through something like that, and that kind of reframes your perspective, it reframes life. Um, just like cancer, no one goes into life saying, "Hey, I'm going to get cancer," and reads a book like this is how to
Right.
deal with cancer. But you go through these experiences in life, and maybe at the time you don't realize it, but then now when you have this cancer diagnosis, and me as the guest hearing the story for the first time, I kind of look sometimes at certain things and go, you know what, Charlie's mental aspect here. I made a note like that mental, the way you said certain things. Not that this has been easy by any means. You've been very descriptive in what you've had to deal with, but the way you've said things, my interpretation here, and maybe someone listening as well, is wow, man, like Charlie's got like this solid fortitude mentally. Like, okay, this is happening. Like, hey, I got the full, like, we just talked about like getting the thing shoved up there, man. That is like one of the worst experiences for a male, right? To have that done to you. And I had it done once. I mean, I was numbed up. So it still hurt. My dad, like that was, I know when my dad was going through that, like that was like, he would fight tooth and nail not to have that happen because that's how painful it is. But you had this very, I think just the way you said it, and maybe I might be making stuff up here, Charlie, but like the things you've said in this course of, we've been talking here almost 40 minutes here about this. None of it is any of this is easy. I mean, I think you've put kind of this like, hey, I did it, got through it, move on to the next. Where does that come from?
I've always been a fighter. I've had to fight for everything in my life. As a kid, home life wasn't very great. Got beat up a lot, broken jaw a couple of times. It was tough. It wasn't the greatest experience, but I survived it just barely. I got kicked out of one high school and sent to another one because I was a troublemaker. And there's a lot of other stuff that is involved in this, a lot of religious stuff that I won't go into, short of saying that my crazy parents thought I was demon possessed, and that's where all the beatings came from, and that's where all that hard side of my life. So I've been fighting ever since. And then that's what built this man into who he is, that I have to be my own advocate. I have to find my way through the system. I've been told by the nurse navigator, the oncology nurse navigator, that they have made changes in their system just since I became a patient at Texas Tech, because I am so in your face, but not in a bad way. But at least I need to know what's up and what my next steps are. So she says, because you're a self-advocate and you fight so hard for everything, it's changed the way that the higher ups are doing things now. They've changed protocols. And she laid it right out, said, because of your attitude and who you are as a man, we've changed protocols that are helpful to everybody. I think, I don't know how many people get diagnosed with pancreatic cancer every day, but I'm sure it's a lot. You probably would know those numbers better than I do.
66,000 a year. And I think that, the most powerful piece and that I take away from what you just said, Charlie, is that, this self-advocating. And we've talked about this often on the podcast. the system, the medical system here in the United States, um, is it pay for play, right? Like you have to pay for your service, and there's different ways. Like they cannot not provide care, but they also don't just give you things that are available right within the system.
Right.
And that's something, again, I go back to like something I said before, like there's no book on this, right? Like no one goes into like higher education going, hey, how do you treat yourself with cancer, right? Any cancer, not just pancreatic cancer. And then you throw in the mix of like, this is pancreatic cancer, which is super complex. So there's no workbook that tells you how to navigate through this. And the system, unfortunately, here in the United States, it's privatized. So like what happens at Texas Tech is different than is at MD Anderson. It's different than
Right.
Dana-Farber. It's different than Memorial Sloan Kettering, which is super frustrating from a patient advocacy standpoint. Um, in other countries, it's a public healthcare system, and that's a little bit different. But then there's like pluses and minuses to that. Like
Sure.
similar to what you experienced, like waiting 6 months to get a procedure is like crazy, right? Like that's just not how the system helps people. And I don't think it's comforting to hear that the nurses are telling you like, hey, like we've changed some things, because I often say like you got to worry about controlling what you can control within the scope of what you have in front of you. And
Right.
sometimes patients, that's hard because some people just don't have that personality to speak up. But you kind of have to be forced sometimes to do that. And the system is so big that I don't think these changes and I think some of these are like common sense stuff, like just like being like receptive to answers or questions that a patient has. A lot of times, like we hear from patients and their families, like the doctor gives them 5 minutes. They don't get time of day, right? They barely get like a hello, hey, how you feeling? Okay, like that's it. Like, and I'm like,
Right.
if you have questions, like you as the patient should be able to ask the clinician those questions and get answers in return. Like that's just common sense. But like, I don't know, that doesn't happen in a lot of settings. And I think people have a real hard time being that person to say, hey, I've got a question. I didn't get my answer. Can you back up a little bit?
Yeah, I've got an excellent support group in my family and my children. Um, as you said, I had I have three children. My youngest daughter lived in San Antonio. Well, she's pulled up her entire life and moved from San Antonio to be here in El Paso to help me out. She's the one that's done the most research. She looks into everything. She, so she helps me out to no end. She keeps my calendar because you can imagine all the doctor's appointments and everything else. So she's fantastic. This is Trisha, my youngest daughter, and she's got a 3-year-old son and a daughter on the way. Anyway, no more than 2 weeks away. So she helps me out. She went online and found some alternate meds that do not diminish the chemo. I didn't want anything to take away from the chemo.
Yeah.
The docs, I have to trust that the docs are not leading me down a primrose path, right? So we found some stuff. I don't know if I should mention what it's called or not.
Yeah, you can mention what anything that's helped you in this journey, and whether it's complementing the recovery, enhancing recovery, or allowing you to function better than you did before you had taken any of these meds, like or supplements, whatever it is.
One of them I'm sure everybody's heard of is turmeric.
Yep.
And the properties that it has for anti-inflammation and stuff like that, which is good, which has helped me somewhat, especially after the chemo sessions when the docs have you on what's it called, dexamethasone,
Yep.
which is a steroid, which
yeah.
just totally screws me up. It just turns me into a noodle. That's what I call myself, a noodle. I mean, I don't want to do anything. It just kind of like, the fatigue is ridiculous. But I'm also, she found something called, it's an endodropper, and it's wild turkey tails. And so, we did our research before we started taking it, and there's some other stuff that we're looking at. I can't remember the name of the the medication, but it's something that was touted a lot during COVID. Has something to do with it's anti-malaria.
Ivermectin.
Ivermectin. Thank you.
Yeah. Which there's actually been studies recently, and so ivermectin has been around for years, right? Like
forever, since the 30s.
And it's used as an anti-parasitic, right? And lowering inflammation. And that's where in COVID, and there's actually been a lot of work in cancer recently because of the popularity of ivermectin during COVID. And there's clinical data out there that shows this. So it's not anything hocus pocus, as I would say. I think, Charlie, I appreciate you sharing this. I mean, I think everyone's journey is different, and everyone, like, we go back to this personalized medicine, and I think anything that can benefit recovery, lessen the effects of the chemotherapy, those are like winners in my opinion, and we love talking about them here on the podcast. And of course, I'm not a doctor, I'm not a clinician, I'm not a researcher. Always do talk to those folks on your team, which you have mentioned,
right,
like part of this team. But I think it's naive for anyone to not think about things outside of the box that you get, or to bring up those questions, right? Like some of these places, some cancer centers have alternative medicine as a complement to traditional chemotherapy. So it's something definitely to bring up in conversation. And I'm happy to hear that you've found some success, working with some of these things alternatively. I got a couple of questions left here for you. But I do want to go back to, so you're in this infection right now, trying to get through that. And then is the plan then to continue with the chemotherapy?
Continue with the chemo, right? So I've got 2 weeks left on oral antibiotics. And then at that point, blood tests and all that does. Yeah. As long as there's no cultures or anything in my blood, then they'll put me back on chemo. So I'll do session number 6. Now, session number 6 will be the last session with the what's it called? It's the one that causes necropathy.
Oxyplatin.
Thank you very much. So they're going to take the oxyplatin out of the mix and just give me the 5-FU and whatever the other one is.
Gotcha.
F5U. Anyway, so yeah, that's the plan. I don't know how many more sessions. The good thing, as I said earlier in the podcast, is that the last CT did not show any metastasis, did not show any growth, didn't show any shrinkage, nothing. Yeah. Maybe two
stable
millimeters
disease.
of shrinkage. Yeah. It's stable. Stable is as good as you get right now with pancreatic cancer.
Right.
And, oncologists, my particular oncologist, he doesn't mince words. He's not telling me, okay, you're going to be so much better in a year. He says, this is incurable. Pancreatic cancer is incurable. The best you can hope for is to extend your life. And I'm like, okay, but that's not who I am. I'm going to fight it. It's either going to beat me or I'm going to beat it. But if it beats me, it's going to know it's been in a hell of a fight.
Yeah.
Because that's the only way I know how to live.
It's powerful.
I think part of it might be the biker in me too, but that's just because I wanted to throw in that I'm a biker.
I love it. And we could see the Harley t-shirt, and I see a little bit of remnants of the Harley on the back. Do you ride?
I gave it up once I lost all this weight. Dude, I've gone from 330 to 170.
Wow.
Since last September. I have a big Road King Harley. Still have it. I've been trying, valiantly to sell it, but nobody's spending money right now. Anyway, so it weighs 1,300 pounds, and I just can't handle I lost so much muscle mass in the same time that I lost body mass.
Yeah.
So anyway, no, at this time, I no longer ride, unfortunately.
Well, there might be a ride down in the future, though. Maybe we'll.
I can always downsize to a soft tail.
That's what I was gonna say, soft tail.
But soft tail's my preferred bike. Yeah. Soft tails and rigid frames from the old days. Yeah. But I go back with Harleys to the age of 14.
I love it. I love it. My next question here, and the next couple of questions here, I always preface this kind of loaded, is the term I use. There's no right or wrong, but given your experience and what you've gone through, or Charlie, from the email, you talk about family. You mentioned family a lot here. First question on this note is, what's it been for you to have your family involved? And that you mentioned support. And I always say, like, no one does this alone. And regardless of whether you have a big family or don't have family members, there's groups out there, there's support systems. But let's talk a little bit about the family.
Well, I mean, it's like getting this session set up today. My son set this up for me. You know, he's a teacher. He's been teaching for almost 21 years. And he teaches like engineering courses, IT, stuff like that in the high school level. And, so he's here for me whenever I need him. Recently, we had to do a project in the backyard because my wife is 65, so she's older than I am. And she has her issues as well. And so, it's 108 degrees outside and we're watering our trees because we don't want our plants to die. So my son came out here and he trenched the backyard and put watering lines all the way to all the trees. So his mom doesn't have to do that anymore. We can just turn on the valve. And something I should have done years ago, but I wasn't worried about it because life was normal. Yeah. My middle daughter, she's also in the trucking industry. She runs an accounting department for a big trucking operation here in El Paso. And she's busy a lot. She's got an 8-year-old daughter, keeps her busy. And but she's always here. She's always there to help out. If I have an issue, she'll come just to spend time with me and hang out. She's the one that's probably been the most emotionally affected by this. She's the one that shed the most tears. And then my youngest daughter, like I said, she's the rock. She is literally the rock. But you know what? I'll get up in the morning and I'm like, all right, I'm not a very religious guy for some reasons that I might share another time. But I'll still thank God for the day. I'm not so cynical that I can't believe in a higher power. I can't. But I don't believe in organized religion. That's a whole other story. But anyway, so that's my first thought. My second thought is, all right, these people need me. So let's start the day out right. Let's get off our ass. Let's take our pills, no matter how much we don't want to, because I still have issues, with liquids and stuff. But let's do what we got to do to get the day going. Let's work on our appetite. Let's do everything we can to build up our appetite and get as much food going as we can. Now, some people tell you some really stupid things when you have cancer. And two different nutritionists in different trips to the hospital told me the same exact thing. Eat anything you want, just gain weight. Mm-hmm. Well, that's not really very smart. And unfortunately, I took them to their word initially, and I'm working on that. And it's just like you can't get any two doctors to agree whether pancreatic cancer is a genetic problem or a metabolic problem. You treat them differently depending on what your belief system is. If it's metabolic, you want to starve the sugar. If it's genetic, you do something different. You do what you're doing with the chemo. I mean, I've had doctors tell me, MDs tell me, okay, well, you need to get your body into a state of ketosis, and follow a chemo diet. I'm like, Doc, I got fast for a week or 10 days in order to throw my body into ketosis, which is what you're asking me to do. If I don't eat, I'm already losing a pound a day, taking care of myself, trying to eat.
Yeah.
So that's to me, that's counterintuitive. But I mean, again, these are professionals. They have their opinions. I have to wade through the BS and the medicine and the science and just flat out common sense and try to work something that works for me. But the main thing, that getting back to your question, is these people in my life mean everything to me. They mean more than the Harleys. They mean more than anything else. So my fight is for myself, but my fight is for them. I want to be here for them. I want to see my 3-year-old grandson graduate from college. I want to see I got an 18-year-old granddaughter who's got her first boyfriend. They're living together.
I want to see her go down the aisle. I want to see her sister go down the aisle. I want to see my 8-year-old granddaughter go down the aisle. I want to see Flora, our newest grandchild to come, go down the aisle. Whether I'm going to be able to do all that, because geez, man, that's biting off a lot. I'd have to live into my 90s. Yeah, I think anything's possible if you got the right mindset. If you put your back into, my dad always told me that one of the few things that he passed along to me that made sense was when you put your back into it, you're going to get results. I used to talk about digging ditches, but it doesn't matter. I mean, it all applies.
Yeah, yeah. We can chuckle about that, but it's powerful stuff. And I think, you just had so many golden nuggets, as I use that term, family being important. And again, I use this analogy, like no one goes into life saying, hey, this is how, when I get cancer, this is how to respond. You just are thrown into it, right? And I'm not here to judge, and neither should any of our audience in terms of how people deal with it. I always say, like, find the positives in it and find that power in that, and there is strength in numbers, and family is critical. I mean, you mentioned faith, and we go down the faith rabbit hole not often, but often, and I think that I guess I'll sum it up this way, Charlie. Like, I don't believe, and this is my personal belief, I'm not speaking for anyone else, but going to church every day, or the amount of money you give to church, like whatever religion, doesn't determine your relationship with God, that higher being, right? Like, that doesn't make you, like, just because someone goes to church every week doesn't mean that they're holier than me and they're going to get up there sooner than I am, if there is an up there, right? Like, I'm not here to argue, but right. So I think this is like, that discussion of religion is relative, right? Like, I've seen some, I grew up in a Roman Catholic faith, man. And, in New England, when I was growing up, a lot of priests were doing really a lot of bad things. That's another day, another segment. They right. have their judge to deal with, but that's not, my point is, like, no one's here to judge.
Not our job.
Right? It's not our job to judge, but there is knowing that there's a higher being, and to have that relationship, whatever relationship that is with God, it's powerful, man. And whether that's, Buddhism, Judaism, Islam, whatever that is, that's really special for you individually, and it is individual. My last question here, and this is a loaded question, the loaded question, given your experience and what you've gone through, how do you define the term pancreatic cancer? What's your definition of it?
Well, initially, it was the scariest thing on earth. Doc told me you got pancreatic cancer. I said, shit, Doc, you just handed me a death sentence. Well, he was very positive and said, no, we're going to fight this, which immediately kicked into my positivity part of my brain. Pancreatic cancer, to me right now, is just another hill to climb. It's just another hardship to overcome. I've overcome a lot of them. Some guy somewhere said that hardship builds character. And my answer to that was, man, I got more character than I know what to do with. Simply because my life, nothing has ever come easy to us. The only thing that's ever been easy for me and Patty is the love that we have for each other. That's always been easy. So that's the only thing that in my life that's ever come easy, was the love that I have for my family, for my wife and my kids. So what the hell's pancreatic cancer got over that? So right now, pancreatic cancer is just the next bump in the road.
Powerful stuff, Charlie. I want to thank you for giving me the opportunity, and us here at Project Purple, to share your story. I know we want to share where our audience can connect with you. Maybe there's someone who's going through a very similar journey. But you also have set up a GoFundMe. I know you mentioned a couple of times, like, you don't have insurance, so this is kind of critical in helping. So I do want to give the GoFundMe out. We're going to put it in the link. And I believe if you go into GoFundMe, you can type in your name, Charlie Morales, right, and that should also come up. So, but is there another place where people can connect with you? Like, someone wants to reach out if they're going through a very similar journey?
I'm proud to say that you go to chemo, and a lot of people are just very repressed. They're not extroverted in the least. So I make it my mission to introduce myself to people, especially anybody that looks like a biker. And so I've made some friends that way. And it's important to me to keep up with them, to talk to them, to help them bolster their spirits, even when I'm down, if I can help them feel better about themselves. Because a lot of people have been going through this a lot longer than I have and have had a harder journey than I have. And if I can help a little bit, I will. So I'm going to give you my personal email.
Perfect.
And anybody who's listening to this podcast is welcome to reach out. I'll get back to you as quick as I can. And it's Charlie, Charlie, 61, Cuba, Cuba, at gmail.com.
Awesome. Charlie, thank you for allowing us the opportunity to share your journey and for coming on the Project Purple podcast. It's been an honor to have you as our guest.
Thank you for sharing your time with me. Like I said on the onset, I love to talk. I think I've proven that.
You've proven a lot more than that you love to talk. You are a fighter, and I look forward to staying connected with you. And don't ever change, Charlie. Don't ever change.
Not me. One thing people can tell you about me.
Love it. Thank you for listening to another episode of the Project Purple podcast. If you like today's episode, feel free to share this episode and make sure to follow the Project Purple podcast wherever you listen to podcasts. That's a wrap of another episode of the Project Purple podcast. Until next time, please be safe and thanks for listening.